Hi, everybody. Welcome to Coming in Hot with Caroline. I am so excited for today's episode because we are digging very deep on dermatology. And you know, we all want to talk about our skin, looking and feeling our best. So, of course, I had to speak to one of the experts, right? Cosmetic surgeon, dermatologist, well-renowned, to the celebrities also, Dr. Sheila Farhang. Thank you so much for being here.
Thanks for having me.
I am so excited. And first of all, welcome to Dear Media.
Yes.
Please tell us what your podcast is so everyone can listen.
It's derm approved, where I'm like talking all things skin, hair,
Love it.
health, cosmetic procedures, the forefront, the myths, the trends, what you should do if you want to start Botox, what you should do if you had a really bad experience, the more holistic side of it as far as like integrative dermatology, supplements, things like that.
We're going to dig deep into all of this.
Totally.
I just kind of want to give people real information because I think we need to be transparent, and I think knowledge is power.
Totally.
So let's give them some knowledge.
Knowledge is power, right?
Knowledge is power.
Yeah.
So, doctor, give us a little background on you. What was your passion?
When I was young, I was like, I want to be a doctor. I want to help people. I was raised in like a single parent home.
You were?
Yes. My mother raised all of us, like all four of us, barely
Working
knew English in the beginning. I'm the oldest. I want to do something where I'm like independent, right?
You
Financially independent.
What made you want to be financially independent? Was it seeing your single mom working her ass off?
It was, and that she stayed in the marriage for way too long to have support for the kids, right?
Always.
And I saw my mom get broken down but have to push through it because she was like, he was the only one that was, making money. And me being the oldest, I've always kind of been the person that takes charge. I'm the one that's making sure everyone's okay, mom's okay, my brothers and sisters are okay. Yeah. And so it was just kind of go. But I really enjoyed science too.
You did.
And I was good,
Okay.
Because I was really like, I want to do my best.
So in high school, did you have good skin? Did your mom have good skin? Like, why was skin something that interested you?
I had acne. And
you did.
I saw a dermatologist.
I always feel like that. Like there is something, so right? No, but there's like the trauma that you heal, right? You were lucky enough to heal. But okay, tell me about this. So you had acne. Were you self-conscious? Were you insecure? What was the situation?
Yes, I was. My mom, she finally found a dermatologist. It's so hard to get into one, and they gave me the creams. It got better. Of course, my acne, I had been dealing with for so long through med school because stress hormones turns to androgens, and that is what causes hormonal acne, which is why it's like rampant. I see so many people coming in their 30s. They're like, I never had acne as a teenager, and now I have hormonal acne, which doesn't really respond to conventional acne treatments like retinol and things like that as much.
How come?
Because it's systemic based. So there are certain creams like Winlevi that actually go on the receptor and decrease that extra like androgen, testosterone essentially, where women are kind of just getting like increased testosterone, and that's what's causing the acne. That's what's causing some hair thinning a lot sooner than really you should. A lot of women have like PCOS type symptoms.
Are you seeing it younger and younger? I mean, when you see like, obviously we have a pandemic, we have things, stress is now, I think, on the forefront. I feel like doctors are considering it like an illness. I honestly think stress. So stress affects your skin, correct?
Yes.
So imagine all our teenagers that are going through, this has been a very weird couple of years, right? And we've all been stuck at home. We haven't been taking care of ourselves. And I think that anxiety, that stress level has raised, which like you just said, can affect your body, affect your skin, affect your mental health, let's be honest.
100%.
And all of that is connected. That's why you're saying it's like a full body experience with you, because I feel like you touch the emotional and the physical.
You should. You really should. And you really have to kind of figure out where people are. Like how, like if someone comes in and all of a sudden they have a really bad bout of acne, I'm like, what's going on? Are you really stressed? Did you have a recent move, recent breakup, like a loss in your family? What's going on? Or really with hair loss too. Yeah. There's actually a stress, it's called telogen effluvium. It is a condition where you lose 300 strands of hair instead of 100, and it's in response to stress, emotional or physical.
Really?
Yes.
That's why everyone's losing hair?
That's why people are losing hair. Vitamin D deficiency, I'm seeing a lot in kiddos, like teens. And
what is that from?
20s.
A lack of what?
Well, a lot of things. We don't know why everyone has a vitamin D deficiency. You do get some in the sun normally, so I'm not saying don't wear sunscreen because
there's plenty coming in.
There's plenty of it around, but we don't know exactly why. Is it diets? Is it some type of genetics? Is it something? but I've been seeing a lot of that, and that can contribute to hair loss.
Okay.
Stress, like you said, can wreak havoc on the skin, both causing acne, but also your skin's ability to heal, your skin barrier. So things like eczema can show up when you're stressed.
That's why people have flare-ups,
Yes,
correct?
Yes,
okay.
Yes, so many things. So it's all super related. Oftentimes I will give them like a treatment, but oftentimes that's a Band-Aid. And I'm like, you have to do what you need to do to treat the core, right? They go hand in hand because, for instance, with something like acne, someone's stressed, or, you know, in teenager, you were telling me about your son who has acne all of a sudden, and he, you know, a lot of men, especially like teens starting to work out, if they're taking whey protein, that can cause, especially back acne.
Really?
Whey protein, yes. There are certain foods, but that's the cause. That's like the biggest one. Skimmed milk, of course, like high glycemic foods, fatty foods, things like that. But whey protein is a big one because you have teenagers that are starting to like go to gym.
No, he has a protein shake every morning, and now I don't know if it's.
It could be. It could be. So it's nice.
And all the sweating, right? They're starting to sweat. The hormones.
Hygiene, of course, with guys. You know, they'll go to the gym and then they'll like go out for the day.
Yeah,
exactly. And then you have to kind of talk to them about that, which it can happen to anyone, even women. They'll go out to the gym and then they'll like run errands for the day. So for whey protein, there are some alternatives like pea protein, things like that, changing it where there still has enough protein to build muscle. Hygiene, you want to have like certain shirts that are a little bit more breathable.
Okay.
You want to make sure to convince them and be like, you need, you know, even if you don't smell bad, that it clogs up your pores, all that sweat. You don't even realize it because you're like dried off. So definitely washing right after right after you're working out. And then there's things like benzoyl peroxide that helps just decrease that bacterial load and that inflammation, hypochlorous acid spray. There's a lot of little things that you can do if you are going out and about. Like I will oftentimes like spray my face with hypochlorous acid if I am not washing my face and I'm like, I just got a little bit of sweat, and that'll kind of just help decrease that bacterial load.
What will we do for a teenage boy?
Yeah. So I'll look at what type of acne, because one thing about social media that I don't love is like, it's a very like one-dimensional, this equals this, if you have this, it's this. And medicine is so much more intricate than that. Life is so much more intricate.
It's more complicated than that, right?
Yeah. So there are different types of acne. There's deeper cystic acne, where if it's leaving scars, I'm a little bit more aggressive. There is acne that is like little whiteheads or just clogged pores. So if it's something like just clogged pores, I will prescribe something like a prescription retinoid to help exfoliate, or I may offer like an exfoliating pad or something like that. If I see a lot of whiteheads,
what if it's whiteheads?
If it's whiteheads, it's more like bacteria.
What does
Not
that mean?
bad. I mean, you could still be so hygienic, and that's the thing.
Because it's funny, he does shower as soon as it's funny. So they get to an age where they actually want to shower.
Yes, I know. You could be so, and that's the thing is like people with acne that are really struggling on their face. Like it's not like always a hygienic thing.
Okay.
And it's oftentimes not. It's just sometimes with guys when they're working out, it's on their back and everywhere it's fine. Sometimes I'm like, okay, let's figure out like your
more the back on him. So it's interesting because it's not the face.
Yeah,
it is the
exactly.
Back.
And that could just be the cascade of the acne. It's you have like you have inflammatory acne, non-inflammatory acne, and inflammation is just that like deep, painful ones.
Yeah.
Sounds like, you know, if it's just the whiteheads or red little bumps, that's really easy to actually treat.
Okay.
You just want some topicals like a benzoyl peroxide wash, which this is not medical advice, but you know.
It's secrets for us.
Secrets. We're just talking.
Talk, two girls just chit-chatting.
Exactly. Benzoyl peroxide is really nice to help decrease a lot of the whiteheads.
Okay.
If there's a lot of clogged pores, whiteheads can come from clogged pores, especially if you like feel the back and if it feels really like grainy. You want an exfoliator or some type of retinoid, and sometimes I'll prescribe some heavier stuff like sometimes a topical antibiotic just for a little bit of time, which is negligible systemic absorption is nice. And then you have to deal with some of the acne scarring too. So when I'm dealing with patients, especially on the face or sometimes the back too, if it gets really bad, like really cystic and it's leaving permanent scarring, then
which can be traumatizing for a teen.
Because it's permanent. Exactly.
Even obviously if it's traumatizing for an adult, imagine a teen.
Yes. Then I have so many patients on isotretinoin, which is Accutane.
I was literally just going to ask you about Accutane because I know it's controversial. Like people are like so against it, but I do know 2 people who have gotten a lot of really good results from it. What is your honest opinion on that?
I think it can change lives, especially if we're dealing with someone in their teens, even 20s, 30s, and they have not even like severe acne, but if they're getting permanent scarring, that stays with them. And oftentimes I'm seeing people in their 30s, 40s now that had to be on Accutane, and they're like, I wish my parents let me when I was younger, or I wish that I got on it sooner, because man, if I tell you one procedure that is so expensive, it's treating acne scarring. Really? And it's never 100% perfect. You have to go through really strong lasers. I have to do subcision and release those scars. I have to help with hyperpigmentation. I have to fill those scars sometimes because you just have a loss of tissue. It's some severe scarring.
So we do want to prevent this if possible.
You do. So I have tons of patients, and I think the controversy comes from, so it used to be called Accutane. That's the brand name. So the medical name is isotretinoin. And there's different brands that are that, but we'll call it Accutane because it's easy. It's essentially just vitamin A.
Really?
It is.
So what does all these side effects? So what's the side effects that people talk about?
Like anything, like good things, like too much water, a lot of vitamin A at a controlled dose decreases the oil production, kind of changes the microbiome of the sebaceous gland, and that's why it's really the only cure out there for acne, right? It doesn't really help hormonal acne, but for cystic acne that's been there persistent for years, I will start, and I have a very low threshold to start patients on it, especially if they're getting scarring. My trick is, so back in the day, what we used to do and how I was treated, and this is terrible, is, and providers still do this. I would say not a lot of dermatologists do it, but maybe if you went to a provider or your primary care, oftentimes people are prescribed antibiotics for acne.
I have heard that.
That can mess up your gut. And I feel like I have gut issues just for being on that. And
I honestly remember friends
terrible
taking antibiotics to get rid of like the cysts or whatever it was.
That is so bad for your body. If someone is about to be in their wedding or something, I'll do it for like 2 weeks beforehand. Or if it's like a celebrity about to be on the red carpet, I will inject them. I will give them a little bit of antibiotics to help decrease like some huge flares. But that is not something you should be on for years. So that's number one. I'd rather you be on vitamin A than antibiotics.
Really?
Yeah. The problem with vitamin A, and back in the day, we used to start at very high levels, like 80 milligrams, starting that dose and doing it for like 4 months.
Okay.
That causes a lot of dryness, a lot of just trauma to your body, joint pains, headaches, things like that, because it's drying everything up, muscle aches, things like that. I microdose it in some older patients that are on testosterone, like some of my patients that are like 30 plus that are doing testosterone injections, because they'll get acne from that. But for my other patients, I start at 20 milligrams, and they don't really have a lot of symptoms.
Okay.
The controversy comes when Accutane, there's some studies to support that there is a hand-in-hand maybe relationship. We don't know if it's the chicken or the egg, with maybe possibly causing or worsening depression.
Really?
And that is just one of those things that we always have to ask patients as a screening. There's not a lot of data to support that taking Accutane will cause it, but maybe someone's acne is so bad that it causes depression, and then it's that like vicious cycle.
That little push that they didn't
Exactly. Need. So that is one thing where your doctor will ask your history. If you're a little bit more likely to get anxiety or depression, we will screen and things like that and keep an eye on, or maybe not even start, because there's other things that we could do. So that is the big one. And then number two, people get scared because of pregnancy. So vitamin A, if you're pregnant and you have a fetus, a lot of vitamin A can stop the arms from developing in the right location. This is only while you're pregnant. Only while you're taking the medication. What if you were taking
it and then get pregnant?
You won't, because our guidelines and our protocols from the government are so strict that women have to be on 2 forms of birth control. We have to check the pregnancy test every month before we give them a refill. Because oopsies happen, I guess, and some medications can decrease the efficacy of birth control, things like doxycycline, you have to really make sure you don't get pregnant. And I've never really had that
So
issue.
if you're going to get pregnant, you're getting off of it, and your doctor knows you're getting off of it, and you're going to cleanse your body before you're getting on this.
Cleanse. I would say even for a couple months.
Oh, you are.
Yes.
Okay.
Yes, even though it's out of your system relatively quick. So that is the only reason why we say you cannot be pregnant.
Okay.
But if you've been on it and then you're not on it and then you get pregnant, while you're not
fine.
on it, you're fine, because it's just the specific timing of just vitamin A in that area.
Okay.
Vitamin A is also retinol or retin-A and retinoids.
Oh.
Yeah,
Oh my
that
God,
we
I didn't
apply
think of that.
on our face.
Yes.
Which is why we don't recommend using a retin-A or retinol while we're pregnant. Negligible systemic things we put on our face, on our body, can get absorbed into the bloodstream. Is this enough to cause issues? I would say, out of caution, I would still advise patients who are pregnant not to apply a strong retinoid.
Okay.
Or retinol. Yeah.
Oh my, I found it interesting what
Yeah.
you said, because you said that how they treated you.
Yeah.
So I'm going to circle it back, because I always find interesting, like you said, it's like our traumas, I think, is what really makes us who we are now. And I think it's incredible, because I think there's so many women at home that I think just because you're on, you're a doctor, you're on Instagram, you have your podcast, that you've never suffered anything, that it was easy for you. And then and they think, oh, but it's so hard for me. And it's like, no, I was severely bullied. I believe in kindness for a reason, because I suffered that and I understand what that really means. And so it's interesting when you said you had acne, and it's something that you had to solve. What was the treatment back then? Is that what inspired you to get started? Because you were kind of like, what is this crap they're doing to me?
Yeah, you don't know what you don't know.
Yeah.
You're so young, and then you go through the process of, okay, I want to be a doctor. I'm going to push through this. Getting into derm, you have to be like at the top 1% of your class. It's so hard. It's like Harry Potter, like Hermione. Is that her name? It's that. You have to be like that perfect of academically, socially. It's just a very competitive field.
Right.
And so you almost like don't want to get too excited that you're going to get into derm, even though your test scores have to be in like the top 10%.
Yeah. Oh my
Isn't that
goodness.
insane?
That's insane.
Yeah. But I'm so visual. I always like a life balance. I love research, and with especially cosmetics, it's always emerging. And then I'm a proceduralist, so I do surgery, but I want my patients to be awake. And Mohs surgery, which is what you're familiar with, which is a very specialized technique to treat skin cancers on the face, and then I reconstruct them. I don't do facelifts, but if I do have a patient with a big skin cancer in this area, I will do a facelift to close the wound.
I think that's what's incredible, is that you put your hands in all areas. You do the cosmetic surgery. You're doing the derm. I mean, we're curing cancer, okay?
No big deal. Yes. And then one of my other passions, you go med school and then you go dermatology residency, which is 4 years. And then I did an extra fellowship. And it's usually 2 years, but there's like probably 3 programs in the country. I got into the one in Miami 1 year, and it was Mohs micrographic surgery, which is that skin cancer surgery. Okay. And Mohs stands for the surgeon that developed the technique. It's micrographic, so you cut a little piece of the skin cancer while the patient's awake. I read it under the microscope, and then I close the patient.
And what's cool about it is that the margins are very tight, so they're not taking extra tissue off that they don't need, correct?
Yes. Yeah. So on the nose, you don't want to go and like take out a whole bunch more. Like,
they did that to my dad. They did.
Yeah.
He had like a chunk, and then my mom had I was like, what happened to you?
I know.
So that is like the old way, right?
The old way, yeah. So we want to keep it like super, super tiny. But so for my fellowship, I did Mohs micrographic surgery and then cosmetic surgery, which is more of the lipo, some of the advanced injection techniques. And then I just love integrative dermatology and kind of how wellness and dermatology and supplements, because I am very open, and especially in Tucson. You were asking me what's different about like my patients here in Tucson.
Because she has an office here in Beverly Hills. She has an office in Tucson. And I was just curious, is different locations, are they asking for different things? Are there different demographics that ask for different things, different backgrounds, whatever it is? My mom's Latino. What are the differences? What are you seeing now?
Yeah, it is different. I think my demographic in general are people who want to go to someone who's highly credentialed. So I have an office in Tucson, and I do medical dermatology. Less of that now, but I have another board certified dermatologist at the office and a physician assistant. And then I'm more of like the surgeon, the proceduralist, doing a little bit more high risk stuff. And in Tucson, I see people from teens up until yesterday I saw a patient that was like 97. I'm so grateful to be in dermatology because it is literally the best field. And if I didn't get in, I would have kept reapplying.
You would have?
I would have reapplied for years.
You were that dedicated for real?
And people do. People keep it's getting so competitive now, and people will just keep applying. They'll do another research year. They'll have
I feel like there's not enough dermatologists. I feel like we need more. I feel like I can never get in.
I know.
Literally can never get an appointment. So you're like, check your moles. And I'm like, no one can ever check them.
I'll check your moles.
Okay, I'm coming too.
Yes, please.
You have to make time for me. I have a lot of things to talk to you about.
I was doing Botox on one of my girlfriends, and I noticed something on her shoulder, and I was like, girlfriend, what's that? Because I hadn't done her skin check in a while, and she's always people are pushing out. Sometimes they're pushing that out, and I'm like, if I'm seeing you for your cosmetics, you better be coming in for checking your moles, because you're not walking out of here with a melanoma and I just did your Botox.
You're so right.
So I had to convince her. I did a biopsy on her shoulder. It was a melanoma, so I cut that out. There are some other people that come in where they're like, no, just like sun exposed areas. I'm just gonna like check the face and the arms, and I'm like, well, let me check your back. Melanoma. We find melanomas every week.
No.
And then non-melanoma skin cancers too, because we're in Tucson.
That's true. Yeah, in the sun.
But I mean, that's sunny here too. But the sun in Tucson, my goodness. I've diagnosed skin cancer in people in their 20s. So I will say skin checks, people are a little bit more proactive, like in their 30s to get their skin checked. So there's just so much sun damage.
What time should they start?
If someone has a history of skin cancer, especially melanoma, because melanoma is the only one that's like genetic.
Okay.
It's also sun related, but it's genetic and sun related, versus non-melanoma skin cancer like basal cell, squamous cell, the ones that we do for most skin cancer surgery. Those are not genetic. They're only genetic in the way of like if you're fair skin and your parents are fair skin.
Okay.
Basal cell, we say it's like from really bad sunburns. Like if you've had a few blistering sunburns as a kid, and most of your damage comes from whenever you're a teenager. And your kid.
So if you have when I paid the least attention.
Right? Isn't that insane?
Oh,
it's
that
true.
Sucks.
It's true. And
why it's so important to put
it's never too late.
It's not. Is it never too? Because I sometimes feel like, oh, it's over. Who cares?
No, I think that every time you go out in the sun, you get a little sun damage, right? And your body repairs it. And where you have the sun damage, maybe repeated sun damage, your body kind of just messed up a little bit there. It wasn't able to repair, and that's why in that location you got a skin cancer.
Oh,
that's what
interesting.
Happens. That's what happens. So there are actually some resurfacing lasers. There are some prescription creams that help decrease a lot of that sun damage. I will freeze some areas that are like precancerous spots. Nicotinamide, it's a supplement. It's a vitamin B as in boy 3. That has been shown and published, so it's standard of care for dermatologists to kind of recommend it, is if you take 500 milligrams twice a day, it has been shown to decrease the risk of skin cancers.
Really?
Yeah.
Okay, I'm buying that. Yeah. I'm not even kidding.
And then, of course, there are some supplements that you can take that act as more of a sun protection.
Like what? I've never heard of this.
Yeah, some people take it every day, but I'm like, take it whenever you're like out and about. It's polypodium something. It's a supplement like from a fern that helps. It doesn't replace sunscreen, but it helps protect you from the sun.
I've never heard of this before. I have to ask you about melasma really quick. Yeah. I think it's one of the biggest issues in women with when you're having hormonal changes, when you're pregnant, when you're in the sun. And I remember having a mustache. I mean, I literally had a mustache, and then it moved. Then I feel like it was like on my forehead, like this triangular area. And then I feel like I got something here, and then it kind of went away. And then I feel like it might be back. I don't know. It's what the hell is melasma?
Melasma is
how do we make it go away?
My existence too, because you know what? Some people just get it and some people don't. And it's partly genetic, it's partly where you live, and it's your sun exposure, and it's what's happening in your life as far as hormones. But it is hormone related. So mostly if people are on birth control, if they're pregnant, or if they're on like HRT, like hormone replacement therapy. It is really difficult to treat. You can keep it at bay where it's not there.
Flaring up.
Exactly. It can flare up if you are in the sun. And sun is the motivating, like it's the reason
leading
why it's
factor.
there.
It's
exactly.
Yeah.
So with melasma, topicals that help brighten the skin, that help decrease that darkening will really help. There's things like cysteamine. There are a couple acids like kojic acid, and of course there's hydroquinone.
That's what I did, like a triluma.
Exactly.
Does that make
That's
sense?
a good one. That's a good
okay.
one. With hydroquinone, you want to be really careful about not doing it more than 4 months in a row, just like guidance from your doctor or your provider. And then sunscreen, tinted sunscreen, because guess what? Your melasma gets worse. These lights are making your melasma worse.
Great. I want to speak to my producer.
Phones, screens, all of these LED blue light. And the only thing that helps that is sunscreen that has tint in it, iron oxide.
Okay. So tinted sunscreen is great.
Tinted sunscreen is better for melasma, for sure. Because I see patients, they're like, I work at home. I'm like, not even out. And I'm like, are you in front of screens? Are you in front of a window? Because all of that can flare your melasma.
I feel like this might be a myth. I feel like heat flares it up.
Yes,
like
that's not a myth.
Because I was like, was not in the sun, but it was so hot, and it was like a cloudy day, but it felt like it got worse.
Yes. So LED red light masks, but you have to be careful that they're not infrared, because infrared or those saunas that feel amazing or hot yoga can flare your melasma. It can also flare your rosacea.
Wait, hot yoga? That actually makes sense.
Yeah.
Wait, you do like the red light? I mean, I know it's this whole thing. I have 20 masks at home.
I'm sure you do.
And I'm like, is this really going to work? I don't know why. You're sitting under a red light. And I'm like, does this really work?
You know, it's one of those things that at home, and I like it.
Really?
And there's studies behind.
There really are studies.
Yeah.
Doctor, tell me the truth.
Yes. One of my mentors, Harvard-based, like Rox Anderson, who developed all the lasers, he had a lecture the other day, and it was on low-level light therapy, which is this red light. And they saw on a mitochondrial level, like on a cellular level, that it's stimulating collagen, decreasing inflammation. Of course, you have to make sure you have a good mask. It's not going to replace or be the same as treatments in the office. It's not going to replace Botox or something. It's not going to lift, but a little bit goes a long way, and it's a nice thing. So if you feel good doing it, if you feel like it's improving, it's decreasing your stress, it's you time. That decrease in stress, I think, is honestly more effective than the red light.
So true, right?
It's you time. Well, you can't even do anything with that bright light. I use it too, and my husband's like, I wear the red light cap.
It's hilarious,
for
honestly.
Hair. I wear the red light. And then Solaway, they have a lot of the red light wands. They came out with a mask. They came out with the whole thing. And it's interesting because usually I don't love devices out there. There's a few that I like. Okay. And then there's a few that I'm like, that is a gimmick. That is wasting your money. But red light is really great.
Okay.
If it's not heat-based, if it just is red light, don't feel warm, and that means it's a good, it's well made because it's emitting what it's supposed to. Then it's fine for most skin types. Yeah.
Okay, and what are other devices?
I'm all about depuffing. I am just a bloater. I bloat a lot with traveling, things like this, stress, things like that. So I think more than anything, even though people love the gua sha, they say it's like anti-aging, I love it for depuffing and stimulating more blood flow to the area.
Okay.
So I love a good gua sha or facial roller. SolarWave has like a little wand that you can use too, and that has a little vibration and heat. New face is not bad. A lot of these things are really subtle, and you have to use them consistently, right? Okay. So that's a little.
Like once is not going to make
once
change
is
your
not.
face.
You literally have to do it every day. In fact, there was a study on facial yoga because everyone's like, oh, don't do Botox, do facial yoga. They had people do a facial yoga exercises, I think 90 minutes, 5 times a week.
What?
For like part of a study to see if it actually works. And then they did the blind study afterwards to see how much it helped. And what's interesting is the age decreased by 2 years. So
that's interesting.
Kind of nice. But so many people dropped out. Think about how long that is to do.
90 minutes is crazy.
Like 5 minutes feels long to do something like that.
Yes.
Like
I can't even do the red light. So by the
that.
time I put it on, I'm like annoyed. So I'm like, I don't have a lot of time.
I'm not able to do that in my life. But for people that are doing it, I wouldn't say it replaces anything I offer in my office, but it's not bad.
Not bad. Okay. I think but I think that's good to know because I think people are using so many. They're selling
many things at home.
There's 100 tools now, just like there's 100 procedures, and sometimes you're like, what's the bare minimum?
When you mentioned heat, things like IPL, which is the energy-based light device that helps get rid of all brown spots and all the redness, it can worsen melasma. So I've seen patients, they're like, I went somewhere, I got this laser done, and then they come in with boom, because it's heat-based. Yeah, and it's light-based. But then there are other things like radiofrequency microneedling that's also like heat-based, but it's deep, so it's not going to worsen the melasma.
Okay.
So I think that what someone needs to do is, what bothers you the most. Try over-the-counter stuff first, you know? If it's melasma, you know you got to wear sunscreen. You want to brighten. There are some things that you can use. There are tons of brands out there that help brighten, lighten. It's the things that kind of make the most sense, which is decrease stress, move, eat good, get enough sleep, and that makes the biggest difference.
So it's not brain surgery.
No.
Like, I think sometimes it's like, right, sometimes it's the simplest of things that we're avoiding. Like, we keep putting Band-Aids on and we keep, like, you know what I mean? Like, we keep doing more and more rather than less and less, which is fascinating.
Exactly. What I do love is that, especially in my office in Tucson. So Tucson is a little bit more woo-woo.
Okay, tell me, what's Tucson like?
Tucson, I love. We have Miraval, which is like this like
I have
Oprah.
been.
Yes.
I have been
Wait,
with
in
my
Tucson
mom.
or the Austin one?
Tucson.
Stop.
Yep, I went with my mom as like a graduation gift. We went together. It was the best experience.
Yes.
Like, more people should be doing that.
Yes.
Like, not partying and drinking and doing stupid shit. It honestly was like, you walked out of there feeling like $1 million, which is how we're supposed to be feeling anyway.
Yes, exactly. So I, as a local, it's like I get day passes there and I get to go for the day.
Amazing.
Yeah, so it's nice. But anywhere in town, I think find your safe space, go there. You don't have to go to like a nice retreat, but that is Tucson vibes. People who are there are really into the wellness. The mountains are so calming. I am from Texas, lived in Chicago, moved from Miami, and I'm like, go, 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 city life. My husband is Spanish, from Madrid. We met at a bus stop at 3 a.m.
No, you did not.
Yeah,
wait, I want the juicy story.
I know.
Hold on. Where were you?
Okay. So I graduated college early, and I had a semester before I started med school. So I was like, let me do something out of my comfort zone. Because, right, I'm very like this, which I'm trying to get less like this.
Regimented, right?
I have to just live. My husband, we're opposites. And he's an astrophysicist, PhD. He's so chill and relaxed. And partly it's because he's European too, but we really balance each other out, where I'm like, oh no, I have to work on a Sunday, I have to catch up. He's like, this is a reason why we have the day off. You need to relax and reload your battery. And so I've gotten better about that. But I was in Spain. I kind of figured out some gig to live in a family's home and become the kids' English teacher.
No. Did your mom think you were crazy, or did she think go for it?
I was so independent that my mom was like, sure.
Really?
Yeah. Looking back, I was like, because my little sister's my age now. Like, she's in her 20s.
Wouldn't you think it's crazy now?
Yeah.
Or no?
Yes, I just moved to the country without knowing anything. I didn't even know Spanish.
That is...
Yeah, they were like, even better. That means you won't, like, the kids will be forced to speak English with you.
What was this inkling of, like, I have to get out of my comfort zone?
I think just during college, I was just so really into needing to get into med school and do this. And I was like, okay, I'm about to start med school now. I know I'm not going to have a life, and you really don't. My 20s were, of course, I had, good time, I guess. No, it's not a good time. I'm not going to sugarcoat it.
I mean, you sacrificed it for your future.
Exactly. So you really are not in control of your life. You're in control of your school and training. Don't know where you're living. Your hours are not your hours. You're getting paid like 2 cents an hour. Like, it's nothing.
Yeah.
So I was like, I'm going to just get out of my comfort zone. And I am kind of like, although I'm very type A, I'm still very spontaneous. Like, I moved to Bali and got my yoga certification, and I have those little things.
Hold on. We got to dig deeper. Hold on. Forget the derm. I want to hear all the juicy stories. I know. I'm like, forget this.
We need a part 2.
We need part 2 of the juicy Bali. Hold on. Okay, go ahead.
So I moved to Spain for 6 months, and the very last week, and then I was teaching English, traveling, doing all that. You live with them, and then you're just, travel the other times. And the very last week I was there, 3 a.m. I sound like, now I'm like crazy.
No, it's so
3
fun.
a.m. I was with one of my girlfriends. We finished dinner because everything's so late there, right? And then we probably went to like a lounge. And then at the bus stop, I saw, which is now my husband, 14 years later.
Oh my goodness.
And we just
was it love at first sight?
Yeah.
Like, were you like, you said? Because with me and John, it was like, I was like, wait, why don't I ever meet somebody like him? Because I was like, he's exactly my type.
I know. And back then, like 14, 15 years ago, this was 2010, there was no like FaceTime. So we were Skyping, paying for Skype, emailing back and forth. And we were long distance while I was in med school. He was finishing up college. And he moved here and just things worked out. If your love is into it and your communication is into it, and I think long distance, it's so cool because you get to really know the person.
Yeah. Communication is key to marriage.
And he just became a citizen like a month ago.
That's
Isn't that
amazing.
funny? Yeah.
But
Like,
I think, and he really supports you, which I think is an
Yes,
important, because I think people are always like,
does.
you know, I'm happy because John supports my dreams as much as I support his.
Yeah.
It isn't just about like the man works, he's the priority because he makes money, and then you just do everything else and take care of the kids and you're not important. I'm like, no, actually, when the woman is really happy, that really trickles down to everybody else, which I think why derm is so important. And, you know, people coming to see you, I think that's why it is this therapy session, because I think women want somebody to see and hear them. And I think that's what it can do for you. You are never a waste of money. Like, I just want to be clear about that. Invest in you. You're with you forever. So I just want to remind people that making an appointment with you is an appointment to better their lives, right? It's not selfish.
Totally.
Self-care is medicine.
Yeah.
Right? It's why a doctor, like, at the end of the day.
100%.
And I think we have to give women permission to take care of themselves again.
Totally. That is the biggest investment.
It is, right?
Yeah.
And in your skin.
Yeah. And like you said, it trickles down to everything in your ecosystem.
It really does. If people want to come see you, can you tell us where your locations are again? Yes. What is your Instagram, your podcast again, just so everyone can find out or come see you if they want to?
Absolutely. So podcast is derm approved. And I have the 2 offices. The one here is in Beverly Hills. It's in Rodeo Collective.
You guys, let's all go.
Yes, let's all go. My social handles is Dr. Sheila Derm.
You're in Beverly Hills.
Yes, exactly. And then, of course, my office in Tucson. People fly in, even from here, to like have a little Miraval day and then do stuff there. Yeah. So my practice is called Avant Dermatology and Aesthetics.
Okay.
I'm like the people's biggest cheerleader, and I want them to
really are.
not only look good but feel good.
Yeah.
And I know that's your mantra too, and I love that.
I think that's why we connect, because it is about supporting women having the option and the choice to be the best version of themselves. And again, it's just that reminder that there are women who believe that it is medicine, and we're here to cheer you on. Right? Yes. So check out her Instagram, because she gives a lot of tips, and if you can DM or reach out to you, right? And make an appointment. Thank you for chatting. I feel like we need to talk about Bali and parties and me and you.
Yes,
I don't know.
Absolutely.
And I'm coming to see you.
Yes.
You guys, don't forget to follow, subscribe, leave a review. Kindly, please. We love you. And I can't wait to be coming in hot next week again. Have the best week. Love you all. Mwah.